After opening in 1952, Carlinville Area Hospital quickly established itself as an integral part of the community. Throughout the years, the hospital expanded its medical capabilities with state-of-the-art technology and additional services to keep up with advancements in medicine. But as the new millennium dawned, the need for a modern facility became increasingly apparent for both the hospital and the people it served.
Over time, doctors in the medical community figured out that sometimes you don't need to spend 2 weeks in the hospital after you had your appendix removed. And so, that the census of the hospital, is diminished during that period of time just due to the improvements in medical care. And so it gets a little harder to, work with the same facility under the same circumstances with the same financial results. We probably started somewhere in 2006 talking about do we need to do something different with the building? And so there was more talk about some of the inefficiencies in the old building, some of the things that we needed to repair that had been critical. Other hospitals around were getting the status as a critical access hospital. So the old hospital was depreciated out, a lot of the equipment was older, and really our costs compared to other critical access hospitals was so small that it wouldn't be effective. So they thought then was, let's build a new hospital. We were already thinking about adding on to the old hospital in some sort of fashion, and it soon became evident that maybe we ought to think about building a new hospital.
And one of the things about some of the plans that were given to us and that changed the dollar amount significantly is, should we have a main hallway like we do in this hospital and then a second hallway behind that so patients could move back and forth but not be out among the general public while they're moving from, say, x-ray to back to their room? Those kinds of things. I mean, that.
Yeah, it's the efficiencies and also the patient privacy is a little more acute than I think what it has been in the past, and rightfully so. All of those kind of things would have been impossible to manage at the old hospital, and it's much better done here. We were going to build a 15-bed hospital, and we were pretty well along in the plans, and the architect came back to us and said, we're in under budget, and if you wanted to build the other 10 rooms, because we had talked about we've got a short wing over here, we could add on to that at any time. It was designed to be pushed out. And then oddly enough, within the first 2 weeks the hospital was open, we had all 25 beds full. The day we held the open house for the new hospital, the most common remark I got from most of the community looking around, I can't believe that we've got something this nice in Carlinville. This is really fantastic. It was good to hear that, because we had our doubts up to the almost last minute that, are we doing the right thing here?
We had tons of compliments paid on after the hospital was open. I mean, I would have people talk to me almost every day about, wow, my mother went there, my grandfather, whatever. And I can't believe the services they can provide and how well it's done.
One of my favorite sayings is, nobody can predict the future, and we'll just have to see how that plays out.
Today, the Carlinville Area Hospital and Clinics campus provides a broad spectrum of healthcare resources, from primary care to comprehensive outpatient surgical and rehabilitative services. Though the setting has changed, the goal remains the same: to connect the residents of Carlinville and Macoupin County to the quality, expert care they deserve.